but a quick video for all you who are starting your nursing school clinicals. Because I know my very first clinical day, if I wasn't a person with high anxiety levels, I would probably have had an anxiety attack. I was that nervous. I didn't know where to park. I didn't know where to go. I tried to follow somebody in who was from my school, and then they just disappeared as soon as they got through the doors. So I freaked out and was like, oh my gosh, I hope I go to the right place. There was an information booth. I asked the old volunteer there. The man was like, who knows? So, just some tips. All right. Okay. So, going to clinicals. It's your first day. You probably don't know what to bring. Probably don't know what to even think, do. Probably forgot how to breathe. Don't forget that. That's important. First thing you need to do, get up, clean your ass, drink some coffee, take a deep breath in, out, brush your teeth, don't forget that somewhere in there, and go. Next, you've got your clinical uniform on, you're on your way there, you're driving, got your cup of coffee. You probably aren't allowed to bring anything in other than your most important stuff that you need. What you need, a good pen. I recommend bringing two or three, just in case something happens. I like to get also the little notebooks, the little spiral notebooks. They're probably about that big, about that wide across. Can't turn my hand, sorry. That wide across, and what are they like? 2 by 3 inches or something like that. I don't know. But at our bookstore at my school, they're 10 cents each. You can probably get a pack of 10 for $1, or a pack of 5 for $1 at Staples, Walmart, Target, Office Max, Office Depot, anywhere that sells school supplies, office supplies. That will help you. I write my vital signs in there. I will write pertinent information to my assessment in there. I will write if I have uh, anything I feel important that I need. If I need to write something down for my assignment, because we all have clinical assignments, and you cannot take these forms out of the hospital. HIPAA violation. So good pen and um, a little notebook, paper, something. Next, you will need your pen light because that is an important tool in your assessment. You use it for the eyes, use it to look into the oral cavity, um, and you need it. Okay? Don't question it. You just need it. You'll need a stethoscope. I have a Littman. I've never had anything other than a Littman. I love it. I've tried other stethoscopes. I've tried the Prestige because a few of my friends have it, and I was just curious as to the difference in quality. Uh-uh. You get what you pay for, is what I'll say. I didn't go all out and get a Littman whatever and whatever and whatever that cost me almost $200, but it's a nice one, and I think it's cute. It's purple. Um, your stethoscope, very important tool. You'll use that for your auscultating the lungs, heart sounds, bowel sounds, and it's good to have one that's not going to hurt your ears, that you can hear through very well. I've never had a hard time, I don't think, finding any sounds that I need to find, as opposed to students who use the Prestige brand or some of the other brands. I don't know what they would be. Now, there was one brand that one student had in my program, and it was also comparable to Littman. I don't remember the brand, but it was a nice. Okay, so you've woken up, you've cleaned your ass, you had your coffee, you're there, and with you, you have a pen, paper, stethoscope, pen light. But where are you going to put it all? Get you a bag. Males, too. If you have to carry one of those little drawstring backpacks for the guys so you don't look too whatever you want to call it, do that. I, on the other hand, don't think, no, my clinical bag is in my car. It's a big, huge tote bag. It's orange. sounds tacky, but it's nice. It's really nice. Um, and I love it. I also keep a clipboard, which I learned later on that it's nice to have a clipboard because I don't know, you'll find out. You find your own style. I have one of the clipboards that opens up so that you can put stuff inside of it. Now, I don't know about hospitals in your areas and whatnot, but where we go, clipboards are not allowed in patient rooms. So, there's a downfall to the clipboard, but it's nice to keep everything organized, especially when you have more than one patient. Okay, so you have everything. Do not forget your name tag, name badge, ID, whatever the hell they want to call it at your school. Very important. Um, okay, so it's your first day. You don't know what you're doing. This is my greeting for when I go into a patient room. Hi, my name is Jasmine. How are you doing today? Blah, 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 blah. That's good. Well, I'm a student nurse from, say, your school, and I was just wondering if it'd be okay if I help take care of you today. Blah, 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 blah. The end. So, you'll learn how to approach your patients and how to introduce yourself. It may be different for you, it may be difficult, it may be easy. You may have patients that don't want a student. I mean, and then those that don't want a student after, if you do 2 day rotations, after the end of your 2 days, if you've done a great job and you've taken care of them or their family member, if it's a family member hovering over the patient, more than likely they're going to be more than thankful for you. I mean, I don't know how many times it's happened to me that I've got that family member that's like, I don't want a student in here taking care of my mother. I don't want a student in here taking care of my father. And as long as you just limit your time in and out of the room, don't go in and out 10 times, in one clinical day. That's too much. That's excessive. Go in, get what you need to get done, make sure they're comfortable, make sure they're okay, make sure the water and call light and phone are all in reach, even if somebody's in the room. And you want to always ask, is there anything else I can get for you? Is there anything else I can do for you? And then go ahead and shut the door if they want it shut, leave it cracked if they want it cracked, lights, TV, whatever, leave them in a comfortable position. And at the end of your 2 days, you'll probably get a thank you from that family member that was hovering over them. Don't forget a really good bed, bath, or shower for them, especially if they're an elderly client. The relatives want to see their family members clean.